Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
What's up, guys? This is Erin Faules, one of the Wild Health doctors. I am honored to be with Stacy Sims. So many of you have probably heard of her. Stacy's an international exercise physiologist. She's a nutrition scientist, and she specializes in women's health and performance. She's known for her research challenging traditional sports science, emphasizing that, quote, women are not small men. A former elite athlete, she's had the opportunity to translate research into consumer products and a science-based layperson's book, Roar, to explain the differences in training and nutrition across the lifespan. I will also plug that she's written Next Level, which we use regularly to support our patients at Wild Health. She's worked at institutions like Stanford and was recognized by Outside Magazine as a leader in her field. I'm super excited to have Stacy on to personally pick her brain. I'm a huge advocate of women's health, and I love learning about the differences and how we operate. You know, it wasn't that long ago that women were actively more included in scientific literature. So there's a huge gap here, and I'm just stoked to learn from you.
No, thanks. I'm excited to chat. It's going to be fun.
Yeah, for sure. So, I know a little bit about your personal life, Stacey. I'm just curious if you wouldn't mind sharing what got you, really jived about learning about this field. Like, was there a specific moment or just a culmination of events that led you to, really dive down this rabbit hole of advocating for women's health and some of the differences from, the traditional nutritional and exercise recommendations that we've seen through the years?
Yeah, I mean, the high touch is being in at university and an athlete and just kind of questioning some of the methods. Like there was no representation of women in any of the textbooks, any of the PDFs. And as an athlete doing the same things that our male teammates were doing, and we weren't getting the same kind of results. And then you have women talking about their menstrual cycle and how they're off in the boat in the crew team. And there's just a lot of daily life things that would come up. And then as an academic, not finding any of the answers. And then pursuing a professional cycling career and some other high level stuff and still not seeing optimal stuff for women. And then in my research areas, being told, why do you want to study women? We don't know enough about men. There's just so many things that come down to, I want to know about women because I am one. My mom is one. My sister is one. And of course, I have a daughter. And all of these things, it just doesn't seem fair that women are kind of told they have to be quiet and demure and not take up space and just do what we say when actually there's sex differences in utero that people need to be aware of and how that affects women throughout their life. So I don't ever think the work is going to be done, but I'm just very passionate about trying to make people understand that not everyone fits in the algorithm of a male body.
I've heard you speak enough, I think I read between the lines that it goes a lot more deeply than just the scientific literature here. Like there's this entire cultural like underwriting of this expectation of, perfection and showing up a certain way.
Yeah.
And, like you said, kind of be demure and well, I mean, weren't women actually actively excluded from literature until not very long ago because they were kind of
Absolutely.
seen as anomalies or it didn't fit the typical like expectation of outcome, right?
Yeah, I mean, I always bring it back to the history of medicine and science and who was in the room, who started the research studies, who was in the room when they started looking at techniques and protocols. And it was men because women were excluded and told, oh, no, you need to stay at home. You're care person. You're, the person that has kids, you're not as smart as us. So there are all these kind of structures in play that didn't allow women to have a seat at the table. And that's the history. And it's just kind of no one questioned it. They're like, yeah, okay, well, this is a scientific method and this is what we do. We have a certain amount of time. I mean, things like aspirin for heart health was based on men and then extrapolated to women, and we know that that's not necessarily appropriate. Same with bone density and estrogen exposure, where they applied estrogen to men to see how that affect bone density, whereas that's a completely different scenario than a woman who naturally produces estrogen. But those results were then, kind of extrapolated into female population till we started seeing government agencies get involved and say, you know what, we need to actually study women because we have all these discrepancies in health outcomes. So yeah, it's been a mission and we're still far behind in some of the awareness and traction, but we're slowly getting there.
Yeah, and I see it as something patients are starting to bring to me, some of these questions, which I always see as such a positive sign, right?
Yeah.
Like this isn't strength training. I think is getting a lot more kind of popular for women. There's this big uptick in meeting protein goals, which is like such a counter to I grew up, with this like social message that women were supposed to eat less to become more of a woman. And now there's this more of X to meet health goals. And I think these are such positive strides.
Yeah,
I
I
get
agree.
excited about it. So
Yeah.
very cool. So on the note of nutrition, I think this is one of the most common areas that I see you know, people come to me questioning. Of course, we're a little biased. I think we have a pretty active patient population at Wild Health, but I have trained with all sorts of patient populations in my history of working as a physician, and not always the biohacking, performance oriented crowd, right? So I'm just curious if you had some golden advice for women in general of how to handle their nutrition that is maybe counter to what is, the typical cultural model. Can you elevator pitch it for me? I know it's different for different phases and quite frankly the month, let alone the life and different stressors and all those things. Like, and I want to dive into that nuance, but are there some like big picture views that you'd really want to get across just while we have people at the beginning at least of the podcast?
There are two big ones that I tell all women regardless of age, activity level. One is eat according to your circadian rhythm, and the elevator pitch of that is you eat during the day and stop eating a few hours before bed so that you're not interrupting sleep. Like, you wanna fuel for the task at hand, which is life during the day. And the other is that every eating opportunity to get protein and fiber, because if we're looking at protein and fiber, then we're taking care of our protein needs and our gut microbiome. So those are the 2 big heavy hitters, and then when people start implementing that, they're like, "Oh, I'm starting to feel better and have a difference."
Yeah, I love it. I love it. And I think the not eating late at night and past dark. I mean, we even have genetic SNPs we look at in regards to this, and there's evidence on increase all sorts of chronic diseases of eating late at night.
Mhm.
It somehow it got popular to not eat breakfast and to
Oh, I
eat,
know.
backload your meals.
Yeah, and I look
But
at it too, because when you're looking at the research and you're looking at, primarily women who hold a fast,
Mhm.
they end up eating more simple carb and moving less incidentally in the afternoon, which contributes to fat gain, which is counter to what they're thinking they're doing when they're holding a fast. Like, no, let's look at the research for women. It's not appropriate to wait until 11 or 12 to start eating because it skews your entire circadian rhythm and the way your body responds to food.
Yeah, totally. Makes total sense. And so how about for our performance geeks out there that are wanting to kind of really optimize things and even maybe track, which I don't know your stance on this. I typically don't recommend like stringent tracking all the time. I think it can be quite a stressor and
Yes.
honestly probably not super accurate most of the time. But if you had to pinpoint like rough goals for really active women, do you find that a lot of people are undercutting what those goals would be? Do you have, like, a specific like, if someone's looking for putting on muscle mass, as an example, do you have specific, like, do you go by macro goals, caloric goals? And do you find women tend to like vastly under or overshoot those when they come to you?
Most women don't eat enough, full stop. And I always tell them, in order to build, you need endurance or in abundance. So what I mean by that is you need to have more quality calories, not just calories. I find it really interesting being an expat where I live most of my time out of the country, and then I do a lot of traveling stuff within the US. You go into a general store, grocery store, and there's rows and rows and rows and rows and rows and rows of supposed food, but there's nothing to eat. So I try to explain that. I was like, yes, you might be hitting macro goals if you're looking at getting 1 gram of protein per pound of body weight, but what is that quality of protein? So there's two things. If you're really trying to dial in and build lean mass, we have to make sure that you have the abundance of calories and nutrition density around your training and to support you throughout the day because you don't want a big hole of time where you don't have food. So if you're bookending your calories, beginning and end of the day, and you have a big hole in the middle of the day, your brain is perceiving you as being in a breakdown state. So you're not going to build lean mass. So we also want to make sure that you are eating regularly throughout the day, getting good protein hits throughout the day so that you encourage lean mass accrual and immunity. It helps with your immune system too if you don't have big holes where your body's a bit stressed from no food. And then what kind of food you're having. Because if you're reaching for protein fortified Pop Tarts or you're looking for Impossible Burger or something like that, those are all ultra processed foods, but they're not necessarily like you think of protein Pop Tart. Yes, we see that's ultra processed, but the Impossible Burger being promoted as the meat alternative, it's super processed as well. So we just have to really look at the types and quality because we want maximum nutrient density to really achieve our lean mass gain and our gut microbiome goals.
Yeah, so eat real food and get hits, especially around your training, but don't forget those big gaps. Like, say, if I'm getting you right, say someone's training in the morning and they get a little bit of maybe carb and protein before they go in. Maybe they lift heavy, have a great session, really stress their system. Maybe they have a little bit of fuel following, maybe they have their full breakfast, but then they get stressed at work or, they become super mom throughout the day and they forget to feed themselves or all these real life, examples that we probably both know too well. And then you kind of defeat all the stress you may have put your body through. Like you probably want to adapt to that stress appropriately and really build muscle. Am I getting you?
Absolutely. And then we also see that that scenario plays for so many people when you get home and you're starving. So you're trying to snack while you're making dinner and being conscious of what you're eating. But then you end up having so many calories and pretty full before bed. And you don't necessarily have the time to digest, even if it's 2 to 3 hours before bed. So your sleep is interrupted. And we see that there's a lot of awakenings when you're having a big load of food before bed with hypoglycemia. And you're not going to get that quality of sleep. If you're not getting quality sleep, then you aren't going to get the adaptations that you want because during sleep is when your body is consolidating memories and physical activity and repairing and all of the things that you want to then wake up the next day stress resilient, ready to go. So it's really important to look at how you are getting food in throughout the day. And like I said earlier, protein and fiber at every eating opportunity, especially if you're trying to budge body composition and put on lean mass.
And women need a decent amount. I know protein is all the buzz right now, and it's super important, and I'm glad for that. That people are aware of that right now, at least in my world in my field. But I feel like a lot of the women, I don't know if you see this, I feel like a lot of the women that come to me sometimes are drastically under eating carbohydrates. What
Absolutely. Yeah.
what is your? I mean, because of the kind of like carbs are evil, and obviously, there's a lot of ultra processed carbs. It's not what I'm talking about right now. I couldn't agree more with you that eating real foods, you want carbs that your body has to break down and recognizes as food, right? And probably contains a little bit of fiber and all those good things. Um, but do you see that? in terms of the undercutting the carbs, and how important is that for building muscle and repairing from exercise and adapting to stress?
Yeah, we see low carbohydrate intake, which leads to low carbohydrate availability, plays out as symptomology of low energy availability. So that means that even though you might technically be eating enough calories, you don't have enough carbohydrate, then your endocrine system suffers, your immune system suffers, and you need carbohydrate to help build lean mass and bone. So if you're too low in carbohydrate, we see women end up tired but wired and in unable to sleep well and not getting any kind of performance gains, often seeing an increase in belly fat, even though, they're like, oh, it's perimenopause related. It's not necessarily. So we start looking at boosting carbohydrate intake, then things start to fall into place. And couple of weeks later, they're like, wow, I feel so much better and my body comp has changed. And I haven't really done anything except increase the amount of carbohydrate that I'm eating, which is a huge mind shift for so many people. Cause like you said,
Sure.
carbs, it's such a negative connotation, but women need more carbs than men, full stop. And when we're looking at the carbohydrate intake, most women don't eat enough when they're active, let alone get enough carbohydrate. So that's, we talk about protein and like you, I'm really happy to see the protein conversation coming into play, but we can't forget the importance of carbohydrate either.
Yeah. I think people sometimes feel really good too when they're in ketosis. People will come to me and they get this brain boost and they feel good and I see in the lab work very clearly when women are in low energy availability. I don't deal as much with red S
Mhm.
athletes that are truly getting like endocrine disruption, losing their cycle, stress fractures, like the sequelae that can come from really severe um discordance between the amount of energy you're getting and the amount of strain you're putting on your body, right? Is what we're talking about here. But this low grade version of that, of just everyday life for women, I see in probably 70 or more percent of the patients that come to me. Oftentimes it's I have, low energy levels, my periods are irregular, I'm putting on belly fat, like, and
Really?
they do think it's perimenopause, especially if they're in their 30s, right? When you start to sometimes see some of this. But oftentimes I'm like, well, you haven't slept very well for a few years because you have a 1, a 3, and a 5-year-old. So I'm just reading between the lines
Yeah,
and,
yeah.
you're forgetting to feed yourself and you're doing boot camp classes all day. And I think really maybe that's more what we're looking at here. I mean, it is the most common thing I think I see is that those broad strokes. And I see it so clearly in the labs. Their TSH is a little high and their DHEA is a little low. The sex hormone binding globulin goes up. Like their cortisol is probably dysfunctional. Sometimes their insulin is really, really low and their blood sugar is really, really high. And
Mhm.
it feels so obvious when I look at blood work, and it's so, I think, counterculture, and feels so scary for women to eat more
Yeah.
in an effort to uh, like optimize their body composition. They're terrified to do that. I get
Yeah.
it.
Yeah, I do too, because we've been fed the rhetoric so much through societal messages since we were little that as a woman, you need to eat less and move more to lose weight. But when we really start getting and digging down into it, it's such an awful message because now women are afraid to eat. They hear all these things, and we see a lot of diet trends as more of an excuse to eliminate foods and be okay with it and look like they're appropriate when in fact it's just another means of cutting out calories. And I really hate the diet culture. I like have a real staunchness against it in our household and my daughter's friends, where we talk about being strong and powerful and fueling for what we're doing. And if someone comes in and is like, oh, look how skinny someone is, I'm like, nope, they're not healthy. We don't want skinny in this conversation, which is, how we are here because we try to really emphasize the positive language about it because of that rhetoric of eat less, move more, or eat less just to lose weight. And we see it also in DEXs. I don't know if you've looked in DEXs of women who are late 30s, early 40s, and we're
Regularly.
seeing, yeah, so a high incidence of visceral fat, even though on the outside they don't necessarily look that way. and it's low energy availability. Start eating more, that dissipates. We see better lipid profile. We see better TSH. We see overall energy levels improve. So yeah, I'm with you. It's hard.
And the body's just trying to protect them, right? To hold on to
Yeah,
this fat tissue because it thinks it's starving, you know?
exactly.
So it's trying its best. So in real life, when you get someone like this, how do you approach it? Like, is this a slow increase? I mean, obviously they have to have their own emotional buy-in for something to stick,
Hmm.
um, and their willingness. But if you have that buy-in, medically or scientifically, what do you see work best? Like a really slow uptick of calories to recalibrate that system, or do you dive right in with them? Like, how do you usually approach that?
I work within their day, and most of the time, people are not fueling adequately before and after training. So I use those as eating opportunities that just kind of become a nuance where they're not thinking about it as a meal. It's like, oh, yeah, I'm going to go to the gym. I need some fuel for that session. Oh, I went to the gym and had a really hard session. I need to recover from that session. So I put it into more of the performance metrics. And then all of a sudden, we can increase 500 calories a day without having someone balk at the fact that there's an extra 500 calories. I've worked with quite a few women at a higher activity level where they need an extra 1,200 calories a day. And if I were to say you need an extra almost day and a half worth of meal in your perception, then they freak out and there's no buy in. So we look at a way to slowly implement it over the course of 3 to 4 weeks, which then doesn't freak them out from extra glycogen storage weight on the scale. And we see better energy levels for training, which then feeds forward to more motivation and better adaptation. So it's a way of looking at the day and how are we going to implement some extra fueling without having a negative impact on mental status and the way a woman feels about herself.
That's gold. I'm going to use that advice
Perfect.
regularly, probably. So thank you for that.
Yeah.
Um, how about when you have a scenario? We'll dive into fasting later because I think this is a whole black box we could dive into.
Yeah.
But if someone is truly insulin resistant, whether they're type 2 diabetic or there is some degree of carbohydrate resistance or insulin resistance that, this can be problematic. And I'm assuming this is a very nuanced approach by you, but do you just balance those things, and maybe they have a little bit of a shorter feeding window, or maybe they have a little bit lower carbohydrates and lower simple carbohydrates, or do you find that those things tend to just improve as you build muscle and the muscle still requires carbohydrate, to do so?
Yeah, it's a kind of a combination. It's like as you're building muscle, it becomes more of a glucose sink, which is what we're after. But the process to get there can be a bit difficult. So, first, a 10-minute walk after every meal to really help instigate glucose uptake. And then we're looking at the type of training they're doing. So we try to really implement some sprint intervals because we want that epigenetic change to increase the geeky word of or geeky explanation of translocation of our GLUT4 protein. So that means opening up the cell without having to have the key to bring insulin in to improve the overall structure and responsiveness of our muscle cells. So first we start with, that walk after every meal, making sure that the carbs that are coming in are bound with fiber because that's nature's way of reducing the impact of the carbohydrate on our blood glucose. And then as we're building muscle, we also see our insulin sensitivity improve.
Yeah, I love it. Okay, well, you brought up training, and you brought up sprint interval training. So I've heard you reference polarizing training for women. Could you explain that to our listeners?
Yeah, sure. So if we think about polarizing, it is the very low, low and the very high, high. We want to stay away from the stuff in the middle. Unfortunately, most women who are in their mid to late 30s onwards think you have to have a really heavy, hard, sweaty session to be successful in their training. And it's like, well, optimally, no. We can do a really low intensity as kind of a recovery, but within the session, we want to be able to do an interval at a targeted intensity, and we need to recover between each interval so that each interval that we do is at that targeted intensity. So, example, one of the things that a friend did today as a finisher to upper body workout was 1 minute ski erg, and then her other friend was doing a heavy farmer's carry while she was doing the 1 minute ski erg, and then they switched. So they did that, 4 rounds of that, and then a break, and then did another 2 rounds of that. So it was the ability to hit the intensity that they needed to get the training adaptation. And at the end, it's a sprint and it's hard, but they didn't have to spend a lot of time doing it. And if they were to just carry on and keep doing 6 rounds total, then the last 2 to 3 rounds would not have been at the intensities that they needed or wanted. So it's about let's make sure that our intervals are super quality and we have to have the appropriate, really low intensity recovery in between so that we are getting that stress to the body to create an adaptive response that we want.
Are you ever recommending the more Metcon type of exercises or boot camp style exercises where people are largely in kind of a persistent zone 3, 4 heart rate? Are you seeing benefits there other than, I mean, there are obvious social benefits. Like sometimes the best exercise is the one you'll do, and the one you enjoy, and you can meet your friends there, or like people love pickleball. I never want to take it away, or people love going to tennis with their friends. So aside from those things, which truly truly matter, like just from a physiologic standpoint for women, do you see times when there's major benefit to those, or would you just assume women lift heavy and get some true hit intervals and we also love a low zone cardio for cardiorespiratory fitness around here and longevity. But just curious your thoughts on those, this because they're very popular. These types of classes.
Yeah, they are super popular. And um, in the ideal world, women wouldn't do them, but that's not ideal. Because we look at it and yes, it's a social connection. It's the feeling they get from accomplishment of it. And it's also some people's soul food where they're like, yeah, I go
Sure.
and completely mental release. And I don't ever want to take that away. So we look at what is the maximum benefit for the time that you have. So ideally, we want 2 heavy lifting sessions and one true hit and one true sit session a week. So that's 4 sessions that you have. And maybe it's actually 3 days in the gym. And if that's all you have, that's optimal. But if you're like, I really miss my friends, I really love going to the boot camp, and I want to go to Orange Theory, make those classes work for you. And I feel like I'm constantly reminding women that you're paying to go to these classes. So if it's not working for you and you feel exhausted and you're not getting benefit from it, don't stop going, but work within the confines of those classes. So maybe in the boot camp, you're doing less reps and heavier weight, or
Mm,
maybe you're going to pick that day just to do the high intensity work. So you're dropping the weight and just doing the movement efficiently. If we're looking at something like Orange Theory, maybe you're focusing on the splat points on the treadmill, and that's your intensity for the day, and you're really working that intensity. And then when you go to the strength training component, you're working on functional movement and really working on how am I going to move well. So the next time, I'll just use the treadmill as a warm up or low intensity stuff and I'll really nail the strength training. So it's within the confines of the class that you can make it work for your body because you are paying to go and you want that to be beneficial for your body as well as your wallet. So it is a little bit of a self-confidence thing where you have to say, yeah, I'm going to this class and there's some things I don't want to do because it's not appropriate. But it's beneficial for you to modify and you get the social constructs, you get the ability to be with your friends, you get the benefit of being in a class, and you have ownership of what you are doing to benefit your own body.
sure, sure. And uh, obviously we want to meet people where they are at different life stages and what they enjoy or what they're comfortable doing. A lot of women have never stepped foot around barbells or even around weight machines, or even around dumbbells. Like this is so new.
Yeah.
to a lot of women. I do think it's changing, but again, I have a biased lens for sure, and I love strength training, so, um, but for our performance-oriented gals that are more comfortable with this, um, what's your biggest are there big changes in life stages? Like, I know postmenopausally, it gets much harder to recruit new strength cells or recruit new muscle cells, right? Like, I have my thoughts on this, but, you're the expert here. Like, what do I think that's probably the most common question I get, but, there's major differences in a woman when she's in her 20s and early 30s, and then, especially like post 40 and then especially postmenopausally and how we adapt to training. So especially in that postmenopausal range, how do you, or even before that, perimenopausally, like how do you recommend women that are comfortable with these different methods of training? Like what are the big shifts you tend to make in them to see the best results, both you know, for their quality of life goals, but also for longevity, right?
Yeah. So regardless of age, I always tell women it's the quality over quantity. So we want to look and make sure that you can actually do the quality sessions and have adequate recovery day to day, week to week. So it's like really modifying what you're doing to make sure that you're getting the maximum out of the effort that you're putting in. As we get older and become less anabolically responsive to strength training and protein, then we have to look at what's going on in the body. And yes, we know estrogen is part of the conversation, and estrogen receptors also part of the conversation, but it's the loading too. So if we are more resistant to building muscle, we have to look at the kind of a load that we're putting on and how the central nervous system responds to that load. 'Cause women are born with less of our fast twitch or type 2 fibers, so we need to encourage keeping that component as we age. So part of it of looking at keeping that component as well as being able to stimulate strength and mass development is creating that external heavy load to stimulate central nervous system response instead of being more reliant on hormonal response for building tissue. And we also have to look at explosiveness. So a lot of women who are 40 plus are not really that knowledgeable or don't have a lot of experience in explosive movements, plyometric type movements.
Mhm.
And it's not necessarily about that. It's about, okay, if we are comfortable with a barbell, let's work on tempo. Let's work on a slow descent and an explosive power out. Or maybe we do some French contrast training where we're doing a heavy load and then some banded squat jumps. So we're getting some of the explosiveness, but we are reducing the fear and barrier to entry into that. So it's more about as we age, we have to look at how the body's responding to exercise and it's becoming more and more resistant to the type of training we used to. So we have to find another kind of external stress that's going to create adaptation. So it is the high intensity work. It is the super low recovery stuff. We have to look at the loading that we're doing and the type of periodization that we're doing within the loading to keep building that lean mass and keep building the ability to produce power.
In terms of loading, in just the amount of actual physical load that someone's putting on their muscle when they're strength training, I'm assuming that's a moving target depending on how their strength is growing.
Uh huh.
So do you tend to go by rep count or just feel in terms of, I like to tell people unless they have a really good spotter, they probably need to leave one or two in the chamber there. But
Yeah.
what is your typical advice for people in terms of what this looks like in the real world?
Yeah, there's 2 ways of going around it. For people who are, really well trained and very comfortable, then we use reps in reserve. People are familiar with reps in reserve. Um, if someone is first starting their strength training journey or trying to phase them in into lifting heavier, we go with rating of perceived exertion, starting with what is your mental on a scale of 1 to 10 versus your physical on a scale of 1 to 10 when you come into training. So if you mentally are a 2 and physically you feel like you're a 6, well, let's do a couple of heavy loads that are not cardiovascularly taxing, but more central nervous system and see if that brings the mental up. If it doesn't, then we're just going to go on rating perceived exertion, trying to keep you around a 4 or 5 as you're lifting and keeping the reps around that 8 rep range. So we're not worried about how much you have left in the tank. We just want you to move with good form and technique. As you start getting more trained and more familiar with your body, we still use the mental and physical, but we try to push those heavier loads to having 2 reps in reserve. So that could be you are loading and maybe you're doing 10 with 2 left in reserve, but really we want you down around the 7 range. So it is a moving target and it is a journey. So we don't want someone to go, oh, here's a 6 week program and this is what I'm doing. We're like, okay, here you are. Let's work on movement first. Let's work on functionality of movement. Let's see how you're feeling, how you're understanding the loading process. And it might take you a year to be able to lift a heavy 3 with 2 in reserve. And that's fine because it's a journey and you're going to be accumulating strength and lean mass as you go.
Do you see any difference for women that you work with? There's a lot of debate in the bodybuilding world and the performance world. Should these isolated movements be done? Should we be doing compound movements? Full body days, push pull days. This whole debate. Do you see it really matter as long as people are lifting with appropriate form and load?
Consistency is the biggest thing. We need consistency. And if you want to get into the weeds and we look at compound movements with maybe some isometric holds in between, it depends on what you're trying to do. For a lot of women who are more injury prone, because as you get into perimenopause, we see a lot more soft tissue and joint injuries. We
Sure.
look a lot of the isometric stuff to complement some lighter compound movements, just to get more out of the movement and not create incidents of an inflamed tendon or soft tissue. So it is a little bit of a nuance in that, but consistency is the biggest thing. It's just keep going. Even if you have a scheduled deload week, go to the gym the same time, but work on technique and mobility. Like
Sure.
it's that consistency.
Yeah, makes sense. And just out of curiosity, bringing up people with injuries, obviously the risk of atrophy or tissue loss can go up extensively as people age, and it doesn't take many days off to speak to consistency to lose a massive amount of muscle that's very very difficult at certain ages to regain. Sometimes
Mhm.
we like to use things like EMS suits for people, like postoperatively or around an injury to maintain muscle mass. Do you use those at all, or do you have any thoughts on them? Just out of curiosity, like catalyst suit or what? I'm not. This is not sponsored, but
No, I wish I could bring my camera down and show you that my knee is wrapped with voodoo floss right now
oh
for a little
no,
blood flow restriction. Because I had an injury in February with a torn meniscus and distal hamstring tear,
Mm,
and trying to preserve muscle is really hard. So yes, EMS, we look at blood flow restriction, we look
sure,
at all of the things, plus a higher protein and omega-3 intake, because it is, I strength wise haven't lost that much, but lean mass wise have lost a significant amount. And it is hard when you're in your late 40s, early 50s to build lean mass. So, yes, there are tools in the toolbox to use to keep that lean mass because you can always build the strength quickly, but the lean mass and maintaining that is super important.
yeah, yeah. Um, eh, Gosh, for that reason, if you ever have patients on GLPs, which for anyone not that doesn't know what that is, things like Ozempic or tirzepatide, Zepbound, you may have heard Wegovy. There's lots of different ones. At really micro doses, we actually sometimes really like them for certain risk patients for longevity, but we always screen them with DEXAs because that lean mass is so precious. If we're
Mhm.
starting to see a dip, we're really just trading one longevity risk factor for another. That's probably more
Exactly.
powerful, right? And it can be
Yeah.
so hard for. I mean, because anything can happen. If you have one thing that's tipping the scale with lean mass, and then you get an injury or you have to have surgery, and in another life, I worked in critical care, and I have this study that never left my mind that if anyone ends up in critical care for any reason, if you don't have optimal muscle mass going in, you have double the risk of death. Um, I don't care if it's a car wreck. I don't care if it's a appendectomy gone wrong. It's crazy how important it is. and it ties into so many things with chronic disease, or acute disease, right? So
Yep.
it's just so precious to maintain muscle mass, and I'm so excited that, like, people like Dr. Lyon and different people are speaking to this so heavily these days for women,
Yeah.
and giving that a voice. So cool. I'm glad to hear that you're pro EMS suits. People think
Absolutely.
they're so
Yeah.
funny. People are like, "Oh, are you sure?" And then sometimes we'll have people that are like 80s putting on lean vests like crazy, and I'm like, "This is so
Yeah.
cool."
I know.
So
Like, yes, this will keep you. Yeah, because I mean, you look at the older set, I think about my mom, my mother-in-law, and their friend group, and they get sick, they lose weight, and they get excited. It's like, no, because that's not the kind of weight you want to lose. And two, when you're in your 80s and 90s, you don't want to be too light because you get sick. That's it. And lean mass is key. So let's keep looking at Train with Joan and all those other people that
oh,
are
she's
in the
so rad. I should have
awesome.
Joan
I
on the
love her.
show too. She's so cool.
Should. She's awesome. Yeah.
Yeah, that
Great
would
role
be awesome.
modeling. Yeah.
Yeah, for sure. I recommend her plan actually sometimes for my older gals that have never done strength training before and are super
Oh, cool.
intimidated. I'm like, you've got to check this girl out. She is so cool. So
Yes.
yeah,
Awesome.
and very cool. So let's talk about fasting a little bit. This has been a super popular topic, that I've heard you talk about for years now and read about in Roar. Um, Tell me your thoughts on women fasting. I don't want to spoil it for anyone.
I know. Well, there's a nuance, right? So if we think about
Sure.
time restricted eating, that's normal eating, right? You get up, you have breakfast, you eat throughout the day, stop eating with dinner, and don't have food before bed. Perfect. Because then you get a 12 to 13 hour overnight quote fast, but that's what we call normal eating. Perfect. We start getting into the nuances of holding a fast till 11 or 12 and then having a eating window up till about 6 or 7 p.m. or maybe even shorter. It's where we start to see a lot of differences within the literature as well as lifestyle. So when we look for people who hold a fast until noon or after, and they have what they call a late fast, there is no real benefit to that. Like we don't see improvement in glucose tolerance. We don't see improvement in telomere. We don't see improvement in parasympathetic. And that's in both men and women. When we really start to get down into like body composition and hormone pulse, for women who hold a fast and do fasted training, there is a significant misstep in luteinizing hormone pulse and cortisol responses. And these are really important, especially as we get older, because if we are looking at an overdrive of cortisol for small stressors, then of course we're going to be more sympathetically driven. If we're more sympathetically driven, we don't get into really good parasympathetic for sleep. We also see a drive for increase in our baseline cortisol, which again drives more chronic disease issues. And not that cortisol is bad. I don't want anyone to think that it's a bad hormone. It's when there's an overstep of it. So when we're looking at fasting itself, we see that for women who do fed exercise, so either strength training or high intensity interval training, that kind of stuff, we have a little bit of protein before and protein and carb after. We see a greater uptake of adaptation. We see better EPOC or excessive post oxygen consumption, which in layman's term is your elevated metabolism. We see more incidental movement throughout the day. So there's more energy throughout the day. And there's better satiation. We don't have a craving for simple carbohydrate. When we start doing fasted training and people are like, yeah, it's a way of calorie restriction, I'm going to get better metabolic flexibility. Women are already metabolically flexible by the nature of being born XX. So we don't have to spend the time trying to develop metabolic flexibility because we already have more robust mitochondria. We have the ability to switch between carbohydrate and fat because we have a menstrual cycle. And across the menstrual cycle, our body naturally changes its fueling preference because of hormonal responses and hormonal fluctuations. So when we're looking at the general active population, we know that fasting is not good, but it is such a cultural thing where people are like, I've been fasting for years, it's working for me. It's like, well, I want to see your DEXA, I want to see your hormonal responses, I want to see your cortisol, I want to see all of these things. Because when we're looking at what's actually happening in the literature and we're looking at active women, targeted fasting around training and holding a fast is not ideal. If we're looking at postmenopausal women where there's a big push to be ketotic or use fasting for weight control, we see calorie restriction and protein intake work better. So the other thing about fasting, which fascinates me, is that we are in a global area where there are populations that are well overfed but undernourished, and
Sure.
populations that are underfed and undernourished. So the fasting thing, it fascinates me because if we pull it right back down to, let's go back to the normal eating where women are eating within a half an hour to offset that cortisol awakening response, and we're eating at regular intervals throughout the day, everything just flows. Our circadian rhythm flows, our luteinizing hormone pulses flow, our estrogen pulses flow, testosterone pulses flow, everything just works well. And the hypothalamus is super happy. And that's the key thing, is the hypothalamus perceiving stress and threat. With low nutrient density, then the hypothalamus is like, ooh, we better start downregulating. But if it gets regular pulses of good nutrition, then it's like, yep, okay, we have the abundance to build tissue. We have the abundance to have a very robust endocrine system. So fasting is one of those, yeah, like you said, it's a big black box that we can unpack, and there's so many things that come out of it.
So not only are you not giving your system fuel to make the tissue you're trying to build and in the adaptive change you're trying to create most likely with exercise, but you're just stacking stressors when and you're just stressing that hormonal axis more, which women are much more sensitive to than men as well, as the fact that our muscles work differently. Um, Super interesting. So what does constitute fed training in your eyes? Like, how soon before training, obviously, if you wake up and you don't eat and you've been sleeping and then you go work out, that's obvious fasted training, I think. But say you eat a big breakfast and like how long before your workout do you want people to have some fuel to have adequate, support for a somewhat intense training session?
Yeah, so we often get questions from the 5 a.m. club. It's like, what do I eat when I get up at 4:30 and roll out of bed and try to go to the gym and start working out at 5:15?
They probably
Versus
don't want
those,
an omelet then.
yeah, yeah, why not? And then you have those who like have breakfast and get the kids off to school, and then they have the time to go to the gym. So if we talk about the 5 a.m. club, you want something that has a little bit of carb and protein. So, I mean, I circulated the protein coffee idea on social media. That's one way you can do it, where you're getting 30 grams of protein in pretty quickly. But if you're not a coffee person, you're like, I don't want to use protein powder. Maybe you're having a few tablespoons of overnight oats, or maybe you're having a little bit of yogurt before you go, or maybe you're having protein water during your training. So you're getting some protein amino acids and then having your real breakfast when you get home. But if you're someone who's like, I've had my breakfast, I've gotten the kids out, now I have time to go to the gym, and then I'm working in the afternoon, you have 90 minutes. If it's been more than 90 minutes since you had your breakfast, then maybe you're going to top up with a little bit of protein
Mm,
and then get into
okay.
your heavy strength training.
How
Yeah.
long after training do you like women to have a real meal or some real fuel to
Yeah.
positively adapt to what they just did?
Yeah. So there are two things to consider here. We see that women come back down to metabolic baseline or your resting blood glucose levels within 45 to 90 minutes after a session. When we're looking at the hypothalamic responses, we are in a breakdown state during exercise because we're not building tissue. We are having muscle contraction and breaking down tissue for fuel. So that is a signal to hypothalamus that we're in a catabolic state. As soon as you bring food in, it signals to the hypothalamus that we have nutrition and we're able to start repairing and rebuilding. If we delay that intake, we stay in that catabolic state. And the issue with that is it's still a signal to break down tissue. So if you've gone to the gym and you've done a heavy, hard training session, and then you're not refueling afterwards and you're holding it until lunchtime, which might be an hour, hour and a half or more after your training session, you're not actually signaling to build mass or repair that tissue because the hypothalamus is like, wait, there's no fuel coming in. I got to maintain this catabolic state. So when we're looking at sex differences, right, and we see this window supposed window of opportunity post-exercise. In men, the hypothalamus isn't as sensitive, so there isn't really a window. But for women, we want that eating opportunity within 45 minutes. One, to help with that euglycemic control, bringing blood sugar back down to normal, but also telling the hypothalamus, it's okay, we can build this tissue.
This is such a good reminder for me. I'm thinking of the days when I can't get my lifting in at lunch, which is what I prefer. And then if I'm lifting after I'm done seeing patients, and then I'm like, "Ah, I need to feed my infant," and all of these other things are going on, and time can get away from you, right? So this is such a good
Yes.
good real life reminder. Um, in terms of circadian rhythms with strain of exercise and training, are there times of day I imagine this might shift during different life stages and month stages, so maybe it doesn't matter. Maybe consistency, like you said, is key here, but are there times a day you think training is most effective or least effective for women? I don't like people doing intense training right before sleep, personally, but,
Yeah,
aside from
interferes
that.
with Yeah. Yeah, if it interferes with sleep, I don't really recommend it. We see it's more of a chronotype. So you have the early morning people who do really well, and you have the later night people who do really well. But from an ideal standpoint, you want to be able to have your core temperature drop for really good sleep. So if you're doing a very intense session before bed, you're not going to sleep well. And then you also have the question of, if I have a late training session, how do I refuel? Because you don't want me to eat before bed. It's like, well, actually, I want you to back it all up. So if you have to do a training session at 6 or 7, 8 p.m., you've had the bulk of your food prior to. So you're really just recovering with some protein, a little bit of carb that's going to help with the recovery overnight. But yes, ideally, consistency. And then when we get into the weeds of, is it, if it's really late at night because of shift work or something like that, then we work within the individual, because we want to maintain circadian rhythms, especially when we're talking about shift work.
Yeah, yeah. Oh, I used to work some overnights as a hospitalist. It was very hard to maintain training and, maintain, body composition, and I'm sure insulin sensitivity. Gosh, I'm glad I didn't check it then.
Yeah.
Um,
You'll be
anyway.
glad you didn't.
Yeah. For sure, for sure. It's
Yeah.
like one night of that so you can wreck it, I know. Um,
Yeah.
let's talk about just a small moment on hormones. So, 2 big broad topics. In terms of HRT postmenopausally, I assume I know the answer to this, but do you see, for obviously it's not appropriate for some women, but for a large population of women, it can be medically appropriate. People can see a big quality of life improvement. Do you also see improvement in training? Like, do you see massive shifts for people? Um, is this something that you do you approach training differently for women postmenopausally if they've got estrogen on board or not, or not really at all?
No. So we talk about menopause hormone therapy, and I'll precedent it as MHT because I don't like the UK idea that it's a deficiency syndrome. So we're talking
Mm,
about menopause hormone therapy and the different
I
formulations. We see
like
it.
that.
Yeah, thanks. You can use it. I'll let you.
Reframe. Thank you.
Yeah. So we're looking at all the different components of estradiol. Is it conjugated? Is it micronized? And how it affects the body. The goal of MHT is to have a very low physiological dose to attenuate symptoms. And it is a powerful tool in the toolbox to help people get quality of life back. It is not a physiological dose that is the same as the follicular phase of the menstrual cycle or late perimenopause, because it's
Mm.
still relatively low. So we have to put the work in to build lean mass. We have to put the work in to help maintain bones. It does help with bone density. Of course, we know that. We look at visceral fat gain, it slows the rate of that because it improves the anti inflammatory properties within the cells, but we can do that with omega 3s as well. So, when I talk about the training shifts that occur in perimenopause, it's what you're doing in the moment to help attenuate all the symptoms and help with body composition, but also to carry you through into postmenopause, because you have a biological state. We need to take care of that. You're having all the changes before menopause. And then in postmenopause, we still want to maintain some jump training for bone health. We want to maintain lean mass through strength training. We want to do some intensity work for cardiovascular and brain health. So it isn't a fact of training differently. It's where in the journey do people start to train and apply these concepts. And if they are on MHT, that's just something that they've done to help with quality of life, but it doesn't change the training components.
No free lunch. There's no
No free
shortcuts here. Um, so what I'm hearing from you is those late 30s and 40s are crucial to, building building and maintaining strength later on, tensile strength, bone strength, muscle strength, all the
brain
things.
health.
Right, all the things. It's
Yeah.
really a window to really leverage it if you can. So I will keep that in mind for my low energy availability, lovely patients that come to me.
Awesome.
Awesome. How about for birth control? Do you see that, oral contraceptives rather, do you see that impact training and recovery a lot in your gals that you work with?
It depends on what they're using. And
Sure.
they are kind of experimental in their own right, because there hasn't been much research on them and the different formulations. We see that women who have a 30 microgram dose versus a 20 microgram dose will put on lean mass rather quickly, but won't necessarily have an accompanying strength component. So,
Mhm.
like for power athletes or weight class athletes, it's not that great of an idea to have a higher estradiol dose unless it's medically oriented. We see that there are differences in power generation depending on the progesterone generation. So, there are some nuances within it, and
Mhm.
I really try to get women to understand that if they don't need to be on it for a medical consideration and they're looking at it as birth control, well, let's look, maybe there's some other options besides an oral contraceptive pill because it does downregulate your own natural system. And so we can't really keep
Sure.
track, right? But that's not an option for everyone. So if someone is on an OC, then we look and say, okay, well, what's the formulation? Do we know how it's affecting you? And maybe we can make small timing differences in your training, because if you're taking your pill at night, then it peaks at night, and in the morning it might not be optimal time to train. Maybe it is, but let's play around with it. Let's see what your goals are and
Interesting.
how we can manipulate it.
Yeah, interesting. I've never thought about it from that aspect. I work with a lot of women with autoimmunity, and I have a little bit of a bias lens here, I think, because it can definitely skew gut health a little bit. And,
Plan.
the way your immune system reacts and responds, there's some pretty big increases in different autoimmune disorders, amongst other side effects that I don't know that women are always fully informed about when they make these
Not at all.
decisions. I think, again, that's becoming more of a conversation. And there's obvious benefits. I mean, just the very nature of having this autonomous capacity to make this decision and have these options is awesome, right? But I never thought about the nuances of timing, and I had no idea about the strength component that the lean mass goes up, but the strength is more difficult. Do you see the same in recovery? Do women have more or less ability in terms of recovery from training, or do you see no difference on OT?
Yeah, no, we see recovery differences and HRV differences as well, so heart rate variability differences. So if we're looking at a typical 4-week pack cycle, right, where the first day of the pack cycle is your first active pill. So the first 5 days, you have really good recovery and a relatively high HRV. In the middle 2 weeks, we start to see a decrease in HRV and poor recovery. So there's more DOMS,
Interesting.
there's more sleep perturbations. Um, there's by the 3rd week less of a feel for being able to generate power. And then in the sugar pill week, the first 2 days of the withdrawal pack, we start to see a rebound of our heart rate variability and better sleep component. And then the last 5 days of that sugar pill pack or their placebo week, they feel bulletproof. So it's interesting to see when
Yeah.
people start tracking how they feel across the cycle, it matches when we're seeing these physiological changes as well.
That's super interesting. I know like Aura and Whoop are starting to do cycle tracking. It just makes me so curious if how many of those like are they, tracking that? How many of those women are on oral contraceptives versus not? I don't remember if that question was on there when when I know they're tracking pregnancy and I know they're tracking, oh, you may have ovulated because your HRV's out and your temperature's up. but that's just so interesting to me. On that note, do you have drastic different plans for women that do you have their natural menstrual cycle? Do you have significant changes in their plans, in their follicular phase versus around time of ovulation versus luteal?
From a molecular structure, we know that there are differences, but this is where we really need someone to track their own cycle and see what their own patterns are, because
Mhm.
that psychological component is really important to understand. From that physiological perspective, we see a really high heart rate variability and a really good, robust immune system and ability to push hard in follicular phase. The caveat is ovulation, because you'll still have a bleed even if you don't ovulate. You have an anovulatory bleed, so people think they have a high hormone phase, but you don't necessarily have that. That's why if we're tracking how you feel, then women will become more aware of if they ovulated or not, because they're like, "Oh, I feel really off today. What is it?" And then like, "Oh, I felt the same way last month, but the month before I didn't. My bleed the month before was light, but my bleed this time is relatively heavy," so they can start picking out ovulatory versus anovulatory, and that's how you can dial in your training.
Got it. And if someone did have an effective ovulation and their progesterone is high and, do you steer them away from high intensity training? Is it subtle differences?
I just really work on the nutrition side of things. It's like, if
Yeah.
you have high progesterone, we know you need to have more carbohydrate on board, because progesterone's job is to shuttle all of those amino acids and all of that carbohydrate into creating a really lush luteal or endometrial lining.
Mhm.
So we need more carb on board. We need more protein, because we know there's an increase by around 10 to 12% of your
Mhm.
protein needs. So if we're subtly changing nutrition to support what the hormones are doing, then it's a non-issue. People are fine. So
Yeah.
yeah,
Women's bodies are so insane to me. They fascinate me. I know a lot of the science. I don't know it to the depth that you do, but I'm still like I'm nursing my son right now. And I got back into training, more intense training. Like I moved my body, at 6 weeks or whatever. I started
no,
moving and slowly increasing things, but really started pushing it again in the last couple of months. And I am blown away by the amount of food I need to eat to build muscle, maintain the milk that I'm making, and not feel
yeah,
ravenous all the time.
yeah,
And the amount of carbohydrates I need to eat is absolutely insane. So
yes,
women's bodies just absolutely fascinate me. Like I can know all this, and it's still when I have to, the rubber meets the road and I have to do it, I'm like, I see why people don't do this. This feels like
yeah,
too much to eat.
yeah.
So,
And doesn't it blow your mind? Like, we know all this, we see all this, but yet there are still people who are like, "There's no difference between men and women." Like,
yeah, calories
I
in,
mean,
calories out.
yeah. I'm like,
Yeah.
"Oh, hold on a second, man."
Yeah.
Someday I think about it, I'm like, I would like to be reborn into this world as a man and experience life in a patriarchal society as a man and see what it's like.
Yeah. Yeah.
But realistically, no, because being a woman is pretty awesome, even if you have to fight the
For
system.
sure. It's
Yeah,
beautiful.
yeah.
Well, on that note, I want to be respectful of your time. I do have a couple of just kind of more real world questions for you that I'm personally curious about. You said you have a daughter, and you've kind of experienced all different aspects of being a woman. You have an interesting background. You're an athlete. I think I remember you sharing in either one of your books or on a podcast I listened to. You have a military background, so you've moved around a lot, right? Maybe in your
My
family.
dad, yeah, I was an army brat. Yeah.
That's right. You're obviously, deep into academia. You wear a lot of hats, right? If you had to pass something on to your daughter that you've learned, or any woman in the next generation, like what's your advice there?
Oh, in my dream world, I would have every woman feel confident and powerful enough to take up space and not
Mm,
apologize and not feel like they are supposed to be small and demure, that they have ownership in who they are and their self-worth and just take command of their life. Like, I want women to walk down the street and not feel like they have to be moving out of the way for someone that's coming towards them. And so I pass that kind of mentality on to my daughter and her friends. I'm like, "You're strong, you're awesome, and I want you to take up that space and be confident as you move." Because
mm,
then I feel like that's great for all sorts of sport movement as well as life movement. So that's my goal. That's my goal.
I love that. I have had in another period of my life and still can creep back in a pattern and a habit of even if someone runs into me, my go-to response is to say I'm sorry. Or if I'm trying to move past someone in a store, rather than excuse me, I'll say I'm sorry. I don't know where I learned it. I don't consider myself to really struggle with this topic in general. But it's I think it's deep culturally. So I love that. I got goosebumps when you were sharing that. And then maybe this is more personal for me, but when you have these these real life scenarios, you're working, you have babies or grown kids, you're, wearing a lot of hats, as you do, I imagine. Um, we can know all the things to do, in terms of how much to eat and when to train and all these things. But what advice do you see really works for women in real life when you're, like, what are the most powerful? What's the most powerful piece of advice that you see and have to actually give?
Yeah, I am guilty of rushing through and not feeding myself very well under times of stress. And people are like, "What? Really? You?" I'm like, "Yeah." And here I am sitting injured. It happens to all of us.
Coffee will
But
do,
I think,
right? It's
yeah, or that. But I think one of the most important things I tell women is you take at least 10 minutes in the day just for yourself. Is it first thing in the morning before everything starts kicking off? And maybe your baby wakes you up and you're breastfeeding and you're just like, okay, now I just need 10 minutes to, because we need to show up for ourselves. Right. And if we can take 10 minutes just to calm our mind or just center ourselves, then we're showing up for ourselves and we are more stress resilient for everyone else. And is that 10 minutes maybe doing a couple of 30-second intervals just to wake your central nervous system and body up so that you feel a little bit more empowered? Or maybe it's 10 minutes of sticking your head outside the door and feeling the breeze. Whatever it is that's going to allow you to have that 10 minutes for yourself is super important because as women, we've been conditioned just to take on all of these things, and people are taking our energy all the time, but we never really go, wait, it's enough. I need to just bring this for me and I need this for
Mm,
me. So that
mm.
then you can build from there.
I don't know if you're familiar with the work of Gabor Mate, but I'm fascinated with his work on the intersection of trauma and health. And I work, like I said, with a lot of women with autoimmunity. And his theory behind why there's so many more women with autoimmunity as compared to men is drastically different than what it was decades ago.
Hmm.
I think it's 8 or 9 fold more. Um, his theory is that women are basically the shock absorbers of society. We're taking on and care. We usually care to take on. I don't mean to generalize, but it's typically true with my patients and my friends and all the women in my life. We're caring for children and spouses and patients and colleagues and all of these things. And I think it's a really great poignant reminder to just 10 minutes can make a huge difference. It
Huge
doesn't need to be the
difference.
whole day.
Right.
And it doesn't, need to necessarily it probably wouldn't detract from how you care for others. It actually would probably help at the end
Yeah.
of the day and how
Yeah.
you can show
Exactly.
up.
Yeah.
So awesome.
Yeah.
This has been such a pleasure. Everybody should check out Roar and Next Level and all of Stacy Sims' work. You'll learn a
Thank
lot.
you.
Is there anything else you want to share before we wrap up?
No, not really. I'm just happy to be having this conversation with you and being able to share more insights. So thank you.
Likewise. Thank you. Thank you.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.